So far why nothing's helped. No one's ever explained to you why you have dry eye disease, have they?
No.
It's not Dr. Conklin's fault that he didn't explain why he had dry eye disease. Is he the one who did the cataract surgery?
Yeah.
Okay, all right. You could have seen 4 or 5 different eye doctors, optometrists, ophthalmologists. Wouldn't have made any difference. Nobody could have explained your dry eye disease to you. And the reason is no one has ever trained on what causes dry eye disease. And if you don't know what causes something, how are you going to fix it?
Right.
The reason they were never trained on it is because the residency programs that train us, our teaching institutions, don't know the cause of dry eye disease to this day. They don't know what causes dry eye. The way dry eye is described today, and it was described back when I did my ophthalmology residency, was that dry eye and blepharitis are different diseases. Have you been told you have blepharitis? Surely no one's ever used that term?
No.
Yeah, well you do. I looked at you. You got blepharitis. Blepharitis means lid inflammation.
Okay.
That's what causes the dry eye. But we used to think, and teaching institutions and textbooks still teach many times, that these are separate diseases, but they're not. It's the same disease. Dry eye is just a latent manifestation of blepharitis, chronic lid inflammation. But that's what they teach nonetheless. They teach that this disease is overlapping presentations of different diseases. It's confusing, it's complex, it's poorly understood, it's chronic. You're never going to get anywhere with your patients pretty much. Just give them artificial tears and get them out of the chair. Put somebody in there that's got a cataract or needs LASIK surgery or glaucoma or something like that. Something that's going to make some money for the practice.
Right.
Because dry eye doesn't make any money for practices. People don't know how to treat it. Right? Dry eye patients have really become the bane of the eye doctor. They don't want to see you, quite honestly. And I used to be in that category as well.
I can believe that because it's hard to get anything.
Yeah, it's no one wants to have a room full of patients where you don't understand why they're sick, right? You feel incompetent. You can't explain to them their disease. You sure can't do anything about it. Everything you try, the disease just gets worse. Whether it's home scrubs of baby shampoo or artificial tears in your case, or Restasis or Xiidra, all these things, none of them work. The disease just looks worse. All you guys do is complain, right?
Right.
Rightfully so, because
Do
you're miserable.
something, fix it.
Yeah,
It's not
exactly.
working.
So doctors don't want to see you guys because they just don't know about dry eye disease, and quite frankly, a lot of them have bigger fish to fry. They want bigger ticket items sitting there taking up their chair time and not a dry eye patient.
Right.
Where they have to explain home scrubs and here take some tears. So that's been the history of this disease. You dry eye patients have gotten the short end of the stick for a long, long time.
Okay.
Well, those days are over. All right?
Okay.
Because now we know what causes dry eye disease.
Okay.
And since we know what causes it, we know how to fix it.
Okay.
Now, there's one key word to understanding this disease. This one word. You understand this one word? You'll have the majority of dry eye disease solved. You'll understand it. Okay? That key word's biofilm. Ever heard that term before?
Yeah, he mentioned it.
Oh, Steve kind of shortcut
Yeah,
it.
he said-
Steal my thunder, man. Yeah, biofilm's the key to understanding this disease. Biofilm. Well, what is biofilm? A biofilm is a structure made by bacteria. They produce this biofilm, this polysaccharide sticky solid layer called a biofilm. They make that biofilm for one reason and one reason only. Bacteria want to survive. Makes sense. All organisms want to survive, right? They have survival mechanisms in place. Well, bacteria figured out millions of years ago the best survival mechanism for them, not to be a food source for something else, was to build these biofilms. Because a biofilm is impenetrable. It's like their fortress. Imagine an old medieval castle up on a hill with 10-foot thick walls. It's a fortress, right? You're not getting in.
Right.
That's what biofilms are. They're impenetrable. Now, bacteria figured this out from an evolutionary standpoint millions of years before we even existed as a species. So they got a big head start on us in building these biofilms. But they work beautifully. Nothing can get in. And I mean nothing. So if anybody ever puts you on antibiotic drops, because you get red eyes and weepy or crusty or something, some doctors use antibiotic drops. Well, guess what? They don't penetrate a biofilm.
Right.
You ever had any eye surgery? Well, your cataracts. Okay, before your cataract surgery, they did what we call a betadine scrub, a surgical scrub around the eye with the brown soap. You may not remember that, but they use this brown sterilizing soap around the eye. Well, we now know that a surgical scrub doesn't penetrate biofilms. Our own white cells, believe it or not, can't penetrate biofilms. These things are like Kevlar armor. They
Really?
are, nothing gets in, and they're built that way on purpose. So bacteria have had millions of years to perfect that. Nothing gets in, not even our own white cells. And that's an important concept to understand in understanding dry eye disease.